Hello, WIC staff. Idaho Nutrition Team member Mimi Fetzer here to talk to you about the eWIC card inventory, security, and issuance. During this webinar, we will cover ordering cards for your district, distributing cards to your satellite clinics, maintaining card inventory, issuing cards to our participant, card security for that participant, replacement of lost or stolen cards, and procedure updates. Again, be thinking about how this will affect clinic flow, appointment times, and how it may alter the staff and participant interaction. Let's start with the cards. Cards will arrive in a large box containing up to 6 smaller boxes, also known as sleeves. Each sleeve will contain the same amount of 250 cards, equaling up to 1,500 cards per case. Initially, the state office will provide the clinics with the recommended amount of cards suggested by the eWIC project contractors. WIC coordinators will select a designated eWIC staff person, as well as a backup, who will be in charge of ordering in the future. Your very first shipment of eWIC cards will be determined by the state office and the eWIC bank contractor. This initial inventory is estimated to meet your agency's needs for the first 6 months after eWIC conversion. This estimate is based off of the clinic need and participation rates. Each local agency coordinator will select one person, as well as a backup person, to be in charge of ordering cards for all of their clinics. The order will go through the state office. Once approved by the state office will send that order to the eWIC bank contractor. The bank contractor will ship the cards to the local agency's main clinic, otherwise known as a hub, and it is required for the local agencies to have at least a 3-month supply. Once the order for the cards has been submitted, it may take up to 6 weeks for them to arrive. Whoever is selected to be in charge of the card ordering should keep this in mind for planning purposes. Card inventory will be tracked in Whisper. The state office will make this screen function similar to the breastfeeding equipment log. The expectation is that all inventory records will be stored automatically in Whisper. Designated staff will enter into Whisper how many cards were received, transferred to employees, and issued to participants. More details about how this will look in Whisper will come later. The state office will include a printable inventory log and card receipt log in the computer down kit, appendix section of the Idaho WIC policy manual. There will be one staff member in charge of managing inventory as well as a backup person for special circumstances. The local agency coordinator will establish a system that works best for their clinic to provide satellite clinics with cards. Be thinking of your own clinics. Brainstorm ideas to help your coordinator redistribute cards in the most efficient way possible. For example, South Central Public Health in Twin Falls will receive their order of cards. The local agency coordinator must then decide how they would like to get a sufficient amount of cards to their Bellevue, Jerome, Gooding, Shoshone, and Heyburn satellite clinics. Bulk card security at the clinic. It is federally required that cards must be stored in a locked area that only WIC staff members have access to. Examples of this include a lock and key desk drawer, lock and key storage cabinet, a lock box, or on a shelf of a locked storage room. If there is no lock option, please bring the cards back to a central office at the end of the business day. Tracking inventory. The designated eWIC inventory staff member must review the inventory reports in Whisper each month. Knowing who has cards, or more specifically, card sleeves, and having an idea of how many will help prevent fraud. If after reviewing the reports it is noticed that cards are missing, please work with staff members to identify where the missing card went as soon as possible. This can also help staff know when they need to order more cards. It is expected that there will be a variety of different ways to distribute cards to individual staff members. The staff members who issue checks will most likely be the same staff members who will issue eWIC cards to participants. Let's look at an example. Let's pretend we are in District 4. The WIC coordinator, Angela, has chosen Michael to be in charge of card inventory and inventory distribution. District 4 decides that the best way to keep track of the cards is to give each card issuing staff member a sleeve of 250 cards. When the set time of the month comes around, Michael counts how many sleeves she has left in her main inventory locations and then asks for the card counts from each staff member that received a sleeve of cards. Michael then compares the total physical number against the ones recorded in Whisper, but she notices that the numbers don't match. After some investigating, Amber remembers that she left 25 cards in the Mountain Home office in a locked area so that she doesn't have to travel with them each time she goes. Michael balances the reports and sends them on to the state office with the quarterly reports. Cards will be easier to track if they are still in their sealed sleeve. If a staff member can take a sleeve of cards to a satellite clinic, this will be acceptable even if it will take a long time to go through all the cards. Issuing cards to participants. Most of the steps that staff take in Whisper will be the same as issuing checks. One of the main changes will be asking participants to provide their date of birth and zip code number. The reasoning for this is because the card requires security questions to complete certain tasks associated with maintaining card security. Staff members will want to emphasize the need for participants to provide a zip code number that they will remember, such as a permanent address. What types of issues might occur with asking participants for their date of birth or zip code number? Well, potentially a homeless participant may not have a permanent address. In these instances, have them give a zip code number of the homeless shelter or the WIC clinic that they use. Some refugee participants are issued birth dates upon entry of the United States. Be thinking of possible solutions for issues such as these. Inform participants that these are the security questions that they will be asked when they need to set or reset their PIN. When a participant comes in for their follow-up appointments, staff should ask the participants to verify these two questions at the beginning of appointments. If possible, begin confirming the authorized signer's date of birth now in preparation for eWIC card issuance. Other states noticed this as a lesson learned. They had more wrong than they realized. Practice confirming the date of birth as August 10th, 1996 instead of 8/10/96. Saying the name of the month may help with date formatting issues. Since participants will no longer have an ID folder, some participants may ask the question, "Can I use my eWIC card as a form of identification at certification appointments?" The answer is no. Per policy, participants must provide proof of identity at every certification. At non-certification appointments, cardholders must provide proof of identity or provide the answers to the birthday and zip code number security questions. ID for children or infants will not be required except at certifications. How to issue an eWIC card. Once the questions have been answered in Whisper and the correct food packages have been selected, then staff will swipe the card in the card reader and assign the family their eWIC card. The card is now active. When eWIC rolls out, there will be the option to have a second authorized cardholder. The original authorized cardholder can elect to have a grandparent, spouse, parent, or trusted individual be a second authorized cardholder, resulting in 2 cards per one family account. There may only be up to 2 eWIC cards per family. This person will need to be present at the certification appointment and sign the rights and responsibilities and provide proof of identity. They will also need to set their PIN and provide their date of birth and zip code number when they do so. If a family has multiple foster children, each foster child will have their own account in Whisper. An Idaho eWIC card will be issued to each child. Encourage the authorized signer to mark each foster child's card with a permanent marker or a sticker so that they can remember which card has which child's benefits on it. More information on foster children will be included in eWIC discussions to come. Participants will no longer have their benefits visible on their checks. Staff need to ensure that participants know what their benefits are and what their options will be at the store. Show the benefits list to the participant and review how their benefits will work while in the grocery store. Some options for this include printing the list off or showing them the computer screen if you have that option. With checks, staff and participants had to make some food choices prior to issuing the benefits. For example, would you like peanut butter or beans? With eWIC, the participant can make this decision on their own in the grocery store. Staff may need to help participants set their PIN in the clinic. Participants do not have to set their PIN in the clinic if they wish not to. There will be two places that the participant may access to set their PIN. The first is the interactive voice response telephone number, or otherwise referenced as the IVR. The second is the eWIC website. Staff can help the participant call the IVR in the clinic to set their PIN. Make sure that the participant understands that they should not share their PIN with the WIC staff. Clinic staff will want to ensure the participant knows what to do if they have forgotten their PIN number. If a participant is at the grocery store checkout stand and enters their PIN incorrectly 4 times, their card will be locked until midnight. Ensure the participant knows to keep their PIN safe. Encourage them not to write their PIN down and then store it near or around their eWIC card because this could make it easy to steal. To replace a lost or stolen Idaho eWIC card, participants will be directed to contact the IVR. They will be asked the security questions that we discussed earlier, their zip code number and their date of birth. The moment that this occurs, the participant's lost or stolen card will be deactivated. No one will be able to use that card once it's deactivated. Participants will not be able to reactivate the card once the card has been deactivated. If the participant finds their lost or stolen card, suggest that they cut it in half and throw it away. A new eWIC card will be mailed to the participant, and this may take up to 7 business days. If it is an emergency situation, for instance, if there's an infant needing to be fed or there is less than 7 days left in the month, the local WIC agency can replace the eWIC card. The local agency coordinator will be in charge of defining other emergency situations where their clinic can reissue a card. There may be certain instances where a second authorized cardholder will be removed from an account. If the responsible adult requests that a second cardholder should be removed from the account, their card will instantly be deactivated. WIC staff will not be responsible for notifying the second cardholder that they have been removed from the account. Whisper should timestamp when a second signer is deactivated. Transitioning to the eWIC cards will generate new ordering, inventory, and distribution systems. It'll be important to keep the eWIC cards secure in a lock and key area. Participants will now need to provide their date of birth and zip code number as a component of their identification as well as to set up their PIN number. Clinic staff may need to remind participants not to share their PIN number, even if it's with a staff member, to protect card security. Clinic staff should be familiar with the steps and procedures involved with the interactive voice response number. Staff may need to help participants with setting their PIN, changing their PIN, or getting a card replacement for a lost or stolen card. Clinic staff must ensure that the authorized signer and the second authorized cardholder understand their rights and responsibilities associated with their eWIC card and benefits. Here is a little joke for you all while you process all of that information. So in conclusion, let's make checks a thing of the 90s. Bring on the eWIC cards. If you have any questions, concerns, or comments about this presentation, please feel free to contact your Idaho WIC State Office. We would be more than happy to answer any questions that you might have. Until next time, bye everyone.